And in other news, doctors say a minimally invasive method of surgery is helping to prevent leg amputations in diabetic patients. It involves the insertion of a drug-coated balloon into the blood vessels of their legs. 50 patients at Changi General Hospital have undergone the procedure since it was introduced nearly 2 years ago.
11% of adult Singaporeans suffer from diabetes, and one of the biggest complications of the disease, the risk of amputation.
We are amongst the highest incidence and prevalence of diabetes in this region, and we know that if you have diabetes, with time you will get narrowed arteries in the leg, and coupled with infection, there's a high chance of you getting an ulcer in the leg. And once you have an ulcer in the leg that does not heal with insufficient blood supply, you are at extremely high risk for having an amputation.
But doctors at Changi General Hospital say inserting a drug-coated balloon into the blood vessels could help diabetic patients. Known as a drug-eluting balloon, it widens the blood vessels in the leg, while the drugs prevent scarring and the re-narrowing of vessels. 63-year-old Tan Lien An is one who has benefited from such a procedure. He underwent surgery 3 months ago on his right leg and is now doing the same surgery on his left.
假如你不要做手术啊，等下他生囊或者糟糕要锯掉，所以害怕吗？一定要进来做手术。
Doctors say this type of surgery is especially favourable for elderly patients.
They have concomitant diseases, heart disease, they have diabetes, and therefore a surgery usually requires general anesthesia, which can also be some kind of risk for these patients. We can do these treatments without general anesthesia, just with local anesthesia.
Doctors also say such procedures see a faster recovery rate and are less painful for patients.